Hello everyone, this is Dr. Poornima, founder and owner of Hills Dental Design, where healthy and beautiful smiles begin. Today I'm going to be talking about implant diagnostics. So you are a good candidate for implants. So we said, well, you're fit to have an implant, you've got enough bone. What next? Booked in for a diagnostic appointment. When we say diagnostic, there are two things we are doing. One is where we're going to take an oral scan, and I'll show you a sneak peek of how it's done, and also a CBCT. What is a CBCT? So what's the difference between CBCT and a normal X-ray or a full mouth X-ray? CBCT is a machine where we actually have a three-dimensional image of your jaw. So say for example, if you need an implant, what we are going to do is we are going to have different slices of your jaw and image, and to say, well, is that enough bone to put an implant in? Say for example, putting an implant in is like putting a nail in the wood. So the wood, we need to know and wide it is, the length and the width of it. So we need to have a 3D. So it's amazing these days that we actually have a CBCT, which actually we can see what's going on and where exactly to put an implant. What are the things we are looking at CBCT? So when placing an implant, we are actually going to look at the anatomical structures. So say for example, we want to be away from the nerve, because if you put an implant in the nerve, you might have temporary or permanent numbness or pain. We want to know where the sinuses are, because the sinus, we don't have enough bone. So these are the things we need to know from a CBCT. We also understand what the quality of your bone looks like. So say for example, the bone quality may not be great. So we can actually see from the CBCT what is the bone quality. The bone quality can range, from D1 to D4, and that's probably another topic for a Facebook Live. So we have a look at that. So I'll just walk through and just show you what exactly CBCT looks like. So we've got in our office like a little machine where we look at the CBCT, and then we actually, this is the machine. It's housed in a little room, and it's got a lead lining in it. So it's got its own housing, and we actually can take a CBCT. It is very takes 5 seconds, and we do that routinely for our patients. The other thing what we do is an oral scan. This again is very simple. What this does is it's actually taking an image of your mouth, and we know where exactly how to design the crown. So the CBCT information and the oral scan information is then merged together to make a plan. So just let's have a look at the CBCT one. So the oral scan. So this is called an oral scan. So basically what we do is teeth here that looks like really real teeth, and we have an implant here which we need to place. So we then scan and then see how it looks. So we can rotate, do play it. So that's really good. And that's very simple to do. So you come in, we just take a scan. So it's non-invasive. There is no actually any material like putty material inside your mouth. It's easy and it's clean. So it's done in a few seconds. So the diagnostics, taking an oral scan, so that's used to help with the implant diagnostic, and a CBCT. Now, if it is in the front of the mouth and if it needs any cosmetic work, we also take oral images. Now, in our practice, we routinely take intraoral images, which means we take, the picture of your mouth, your teeth and gums and your lips, just to see the final result, and also as a record keeping. Was useful to you. If you want to know more about implants, we are doing a free consultations. So please call us on 94841913 if you want to have a free consultations about implants, or email us at info@hillsdentaldesign.com. Again, this is Dr. Poornima.